explain. I'm here, I'm alive, making this life happen despite all this craziness that we live in.
Okay, so let me just check what's happening on Facebook because it looks like it's now buffering. I don't know what's going on. Let me just double check from this side because it's like doing some kind of loading thing right now. Let's see. Okay, it's being a bit. Hang on. It did this to me the last time. Yes, I know reminders. Yes.
I am actually in the chat.
You're in the chat? What chat?
Sorry, not the chat. I'm on Facebook. Where's the link in here? Or does it happen right in the event? Oh no, it happens on the page.
So we're here, but it's not loading.
All right, so I went over to the page. And what happens over here? Oh, here it is. Going, oh, it says going live in 0, 0. Yeah, so it's not there. It's probably buffering.
Okay, hang on a second. Let me just try and reboot it. If not, then.
Yeah, it says it's going live in 0 minutes.
All right,
I am over on the page now.
Interactive. Okay, we're just gonna just do this manual
start. Oh,
start.
it was carrying that you did on the second? It was carrying that you did on the second? Yeah, yes. You did carrying first.
Hold on. Come on, man. Jano.
I know the technical difficulties.
Yeah, this is really annoying. Because I'm in the post right now trying to do this. Okay, let's just, oh my God. Hold on.
I want to know what is the restricting factor or the limiting factor.
I don't know, man. Yes, go live now. Hang on.
I'll tell you if I see it come up on my side since I'm
Yes, thank you. Hang on. Application window. Let's try this one more time. Is it live? Are you seeing anything?
Let me refresh. Not yet.
Not yet?
I probably shouldn't have to refresh.
No.
Still no. Yeah, no.
Hang on. Jano, Facebook. I don't like you.
At least we'll get a recording of us trying to figure it out.
Oh my goodness. I really don't. I just hate it. It keeps doing this to me. All right, here we'll manage it then.
It's probably but probably people, too many people on the internet, huh?
I don't know, man. I'm just gonna do this one more time separately. Hi, Facebook technical difficulties. Switch to the previous thingy, and it did this to me the last time. And all of the troubleshooting, and it don't make a damn difference. Hang on. Other.
Well, Daniel calling me now, and Daniel knows. Well, Daniel might not know.
Switch to. All right, I'm just going to try this one more time. And I'm going to have to put in everything again. Not on my timeline. Oh, Lord. Facebook. Hang on, Mario. Sorry for the
problem. Yeah, man. What's going on over on our Facebook? Still doing the same thing, eh?
Yeah. Wait, what is happening? And I did, oh my God. I don't want to schedule it. I want to go live right now. No matter what. I've been doing this for like from, I don't know, about 3 hours ago. I'm gonna set this thing up.
I know, eh?
Hang on. I'm turning off my camera for a second on Zoom.
Yeah, man. You want to see if you can restart it? Yeah, do whatever you have to do. I have a doctor picture up, right?
All right. I want to share my screen. That's what I want to do. That's what I want to do. No, I want to share the Zoom. I'm sharing Zoom. Okay, going live with Dr. Mario Guthrie for a medical Q&A. All right. Let's just share directly into Island Mom same time. Swear. Anyway. Okay, I think we should be. We're live. We're fine now. Hi Mario, how are you?
Hi, Anika, are we there? Are we present? Are we there?
We're fine.
Well,
We're
Anika,
fine. It's just a bit of a disaster, but we're managing. We're good.
I don't see it over here, though, Anika.
You're what?
I'm looking over here, but I'm not seeing it over here yet.
You're not seeing it on Facebook yet?
On my side. But
on
if you
Island Mom?
share on your side, then that's fine. Oh, it says videos live. Oh wow, I'm just delayed. It's working.
Okay, so there would be a delay, but we're good now. So yes, we're back for Island Mom After Dark, and tonight we have Dr. Mario Guthrie.
Hi folks, it's more like Island Mom After Curfew. Yes, because it's not so late.
We have some people joining. So hi, Cavell. So tonight this is a medical Q&A, and this is for moms and dads. Feel free to jot in any of your questions in the comments. I will not be able to view the inbox at this point in time, but we have somebody who can monitor it just in case if you want to submit something privately. However, thank you for joining us again. Let me make sure my phone is on silent. Yes. And tonight we're basically tackling a couple of concerns that parents would have around this time. Apart from the obvious medical, concerns regarding COVID, we have concerns as parents being in our homes, and so brought in Mario, Dr. Mario Guthrie. It feels so weird calling you Dr. Mario.
No, because I wear many hats, but yeah, I'm actually a general practitioner, folks. Some of you may know that. So I'm not a pediatrician, but I do work with kids at the Children's Hospital often enough. So I am comfortable with them. And I've just been reading like everybody and trying to just understand all the things that are happening with COVID.
I mean, and you and I had a little powwow when things started going down on the phone.
Yeah,
and I personally was like panicking. So, I mean, having reached out to you and apart from knowing you as a dear friend, I mean, I thought that you'd be perfect to help to bring some light to a couple of concerns that we all have.
And you know what? I've been doing a lot of this all of this COVID season. So I've been
Yeah, it's a stressful time overall. I can't imagine what it must be like from your standpoint as a medical practitioner. But we're gonna get into some questions. So I would like you to, first off, and this was inspired by a video that I saw on your YouTube channel.
Yes.
Please shamelessly plug that.
Yeah, youtube.com, guys, / Mario Guthrie, MarioGuthrie. It's my medical YouTube channel. And I'm actually trying to get to 200 subscribers by Sunday. So it's my goal. I'm at 163. But long and short, I've been doing a lot of videos on medical stuff. And because COVID is hot, I've been doing that. Anika saw a video about.
I want to talk about the terminology.
Yeah.
So explain to us the terminology of COVID-19 versus coronavirus.
All right, just so that people are accurate, because it's nice to know what the real thing is. COVID-19 is actually the disease, and for short and to make it easy, they call it the COVID-19 virus. So it's a slight differentiation. It's just that the COVID-19 virus causes COVID-19. And another word for the COVID-19 virus is SARS-CoV-2. But because it's so complicated, they decided to go with COVID-19 virus, so it would be easy for the world.
Right.
And I mean, and there's the difference between virus and disease. The virus is the causative agent, the thing that causes the disease. And COVID-19 would include all of the disease elements, which would be the symptoms. And when you have pneumonia and whatever failure you develop as a complication of the infection would be part of the disease process.
So you had explained it with, I think, with the HIV virus that causes AIDS.
And then you see, since we're on accuracy, HIV stands for human immunodeficiency virus. So saying HIV virus is even a redundancy in a way. I mean, yeah, I'm not taking it, but since we're being accurate.
Yeah.
But HIV is the virus. And if your virus isn't controlled, if you aren't immunosuppressed by taking your medication, then you develop AIDS, which is a series of things that can happen within AIDS, which is caused by HIV. But there are two different things. A lot of Jamaicans say HIV and AIDS is the same thing, but they aren't the same thing.
But
HIV
they're not.
causes AIDS. And if you don't take your medication and your viral load goes out of whack and the immunity goes down, then you develop AIDS, when you will have the pneumonia and the dry skin and all of the things that can come.
So with the coronavirus and it causing COVID being the disease, that turnaround time, how, because people coming across a lot of different things out there in terms of, it's your immune response that is the trouble, or what? How do you explain that?
HIV may not be the best analogy in that HIV has no cure. And though coronavirus has no cure, your body can respond to it like a flu. So it's temporary. Whereas HIV is like a continuum. So if you were to take no medication, then you would end up at AIDS eventually. Coronavirus is, you catch coronavirus, about 80% of people will recover. I have an 80-15-5. It may not be perfectly accurate, but that's kind of what I work with, meaning 80% will get it and recover, 15% will get severe disease, and 5% will get critically ill. And those would be the ventilator people. So for the most part, actually, based on what I'm saying, you would think we don't really have to worry too much because most people will recover. The factors that are different about this would be this strain of coronavirus is appearing for the very first time, which means nobody has any antibodies or immunity to it. It's highly infectious and contagious. And it seems to have a higher mortality. And they cannot decide the final mortality until we've gone through the pandemic. But from what we're seeing based on the number of deaths, it is actually more aggressive than a flu in terms of the outcomes. You know what I mean?
Yeah.
So those are the things that are a little scary. And another thing I like to differentiate, you can get a pneumonia from it, like a bacterial pneumonia can develop. But you can get this thing called ARDS, which is acute respiratory distress syndrome, where you get inflammation in the lungs and pretty much is a lot of fluid accumulating in the lungs because of this inflammation.
Right.
Antibiotics cannot treat that. That is why they need to put you on the ventilator, because you'll have difficulty actually expanding your lungs and breathing. So the ventilator is really breathing for you until that fluid can be resorbed or absorbed or kind of be decreased, you know?
Okay.
Yeah.
So just for folks who are watching, I actually have some poll questions. So if you want, you can always jump in and respond to the questions, and we'll take a look throughout, right?
Also, the 4 questions they can answer at any time and you get a percentage. You can see
Yeah,
what,
I'm curious. I'm actually curious about what kind of responses we'll be getting.
and then we can have
So,
conversations around that.
yeah, so I'm actually going to be launching or publishing the first poll question. This one here says, have you been wearing a mask in public? So some of the responses here are yes, no, and sometimes. So please feel free to give us your response. But so Dr. Guthrie,
Yeah.
to mask or not to mask? Because I mean the directives are changing.
Well, you nailed it on the head. The directives definitely have changed. So we started out with a directive from the CDC, which was that if you are not having symptoms, aka asymptomatic, you do not need to wear a mask. The people that need to wear masks are the people who are coughing, and it is protective because if they cover their mouth, then they won't be spraying droplets everywhere.
Right.
Initial directive. We have now morphed. We have now morphed to the most recent thing, which is that people can wear a cloth mask voluntarily in the streets, of course. And this would be to not deplete medical supplies. So we're not talking N95 masks. We're not talking surgical masks. We're talking, you can sew up a nice little cloth mask and tie up and have a design and a pattern. And the reason why we're here now, I think, is because a lot of the research is showing that the virus is not only droplet spread, it's what they call aerosol. Aerosol is a little bit different from airborne. What aerosol is that when you cough or sneeze, the droplets come out of your mouth, they stay in the air for a few seconds before falling. And there are a few implications for that. I guess while they're in the air, maybe something could blow it.
Right.
Could, depending on how close you are to the person. So it really would come down to a lot of chance as to how you get infected by aerosol, but it's still in a way droplet spread. It's just more like it stays in the air for a little bit. So,
right.
And I think also the countries
and that time frame is kind of up in, it's literally up in the air.
There might actually be seconds, and it's based on the weight of the droplets. They've really gone into details about it. There's sizes of the droplets and stuff. And there's also the social distance that's appropriate. Which in my video, I use 6 feet because that's what I have seen. I was seeing 3 feet earlier.
I've gotten a comment that you're a little low. So
I'm low.
Your volume might be a little bit low.
Is there any way I can turn this up?
On your end, just talk louder.
That's right by my laptop. Unless hold on, I'll do something.
How's everybody doing? I'm gonna publish this response in the meantime. And
I had a fan on, so I don't know if turning off the fan will help.
Oh, I don't know, but just elevate your voice, perhaps.
Yeah, talk well loud in my yard. All right, so I was talking about the fact that it's aerosol and the social distance that's appropriate. So if you're out at the tax office or in a line at Wendy's, a lot of people are using 3 feet distance markers, and I like 6.
Yeah.
And the reason is because a cough or a sneeze does have the potential to go as far.
Yeah.
As about 6 feet, or probably a bit less. So 6 is a safe distance.
I think 6 is good too. I'd say 10, but you know.
Wait, I just want to add up one point. There's some research that's showing that a lot of the countries that decided to wear masks are actually seeing better responses, and I think that's a big part of it. So I think so.
Flattening the curve, etc.
Yeah, man, the curve look flatter, even without having people inside. They look a better outcome.
Speaking of which, because you have a really good video explaining like flattening the curve. But can you explain that just quickly to anybody watching what that means? Because maybe some people just don't understand just yet.
Yeah, man, and we assume everybody understands now.
Yeah.
But sorry, we don't have the curve to show you, but you have an X and a Y axis. The axis that goes across is basically time,
Mm-hmm.
right? So
Visual aid.
Anika is the graph. The,
Right.
the the line across is time, and the line up is number of cases, right? What happens in our pandemic is that you end up getting quick spread of the disease if you don't do anything, and you end up with this curve that looks like a bell curve, right? If you do nothing,
Not visual.
thanks, Anika. If you do nothing, the virus spreads aggressively through the population because you have droplet spread contagious.
Mm-hmm.
But if you use social distancing, what you do is slow the spread of the virus. And the aim of social distancing really is only to not burden the healthcare system.
Right.
That's the primary aim of it. So they're not saying that you won't get the disease. And they're not saying that we're going to hide it out.
Mm-hmm.
Really, they're saying that you may all very well get it at some point. Some may not. But
Mm-hmm.
if you do get it, we're all not getting it at the same time.
Right.
That is really because
so it's to keep the curve as low as possible.
the curve low so that it's not like this. And then there's a dotted line that goes across, which is the capacity of the healthcare system.
Right.
And what that means is your number of doctors, your number of ICU beds, your number of ventilators, and you want to always stay below that.
Because if you go above,
if you go above it, you end up with Ecuador, you end up with Italy, you end up with doctors having to decide who stays on a ventilator and who doesn't. Because it's just not enough.
Yeah.
And then they die. And the people who they tend to choose would probably be the elderly.
Yeah.
Because, they probably have underlying illnesses or, they're going probably
That's
let their young.
rough.
And
And
that's
I think because, especially we know as Caribbean territories that our resources are limited, we need to play our own part in flattening the curve, staying inside,
Exactly.
and not overwhelming our medical facilities, which we already know are under pressure.
Jamaica's doing well because, I mean, to be honest, if they do any more strict restrictions, it's going to be because the numbers are going up in a way where we can't manage.
Mm-hmm.
We're just going to lock down the thing.
And I mean, some countries are already on the like 24-hour curfew and thing already. So the smaller islands in particular.
But they're gonna, they're gonna take time with it.
Yeah. So I have a couple of other questions now. Before I drop the next poll question, can you explain, because some advice had come out and it started, getting around that you should not be taking any kind of ibuprofen, any kind of Advil, ibuprofen at this point in time. Can you explain why?
All right, one, I agree with it. Two,
and by the way, you told me this first before I read about it anywhere. So yeah.
I mean, and it's because it's not a new principle for viral illnesses. And for us in Jamaica, you might remember the campaign with the little boy saying, it wasn't a campaign, it was a music video, one Panadol, whatever music saying. The long and short of it was that a lot of viruses can affect your blood counts. One of the important ones is platelet counts. Platelets are important in blocking off a wound or a cut. So when you get cut, these are the blood cells that come to the cut to block it off. Stop bleeding, right? So if the virus is affecting the platelets, usually lowers the count, aspirin, diclofenac, Voltaren, ibuprofen, all of those fall into the category of NSAIDs, and they also affect platelets as well.
Cataflam too, right?
Cataflam, Voltaren, Brufen, aspirin, all of them. And what those medications do, they cause clumping of your platelets as well. By themselves, they can cause platelets to clump. So can you imagine now the virus is causing your platelet count to fall, and then now you're putting this cataflam, and then your platelets clump even more. So you're really just decreasing your ability to stop bleeding. That's the best way to put it. You're decreasing your ability to stop bleeding using platelets. So that means that you realize you bounce your shoulder on the wall, it bruise up.
Yeah.
And this is what happens with dengue. And this is how a lot of the kids die with dengue. Dengue hemorrhagic fever. That's exactly how they die. Their platelet counts fall because of the dengue. and you give them some cataflam to treat the fever, and then they get a bleed.
Yeah.
And then it
And
kills
even
them.
with like a cough can irritate the throat and that.
Yeah, you can cough. You can even get like the eye looking bloodshot. Like you can have nosebleeds. You can have
Yeah.
bleeding from anywhere.
Mm-hmm.
And so usually the general rule of thumb with viral illnesses is to just avoid NSAIDs and use paracetamol.
Mm-hmm.
And if you want to go trade names, that would be Panadol and Cetamol.
Mm-hmm.
Paracetamol is the drug name.
Or Tylenol.
Tylenol. In the US, they use acetaminophen. Same drug,
Mm-hmm.
actually.
Mm-hmm.
Different name, just because it's a different territory. But paracetamol and acetaminophen, same drug.
Mm-hmm.
So if your kids have fever, I would treat them with Panadol.
Yeah. Yeah. I went and bought some Panadol because, I mean, mind you, when Seth usually has a fever, I would go with Advil because I find he responds faster to it.
Right.
But yeah, we put those down for now and we've stocked up on some Cetamol and stuff.
Yeah, and if you're sure, just find your doctor and run it by them, you know?
So I'm gonna put into, because this whole thing has stressed me out, I'm gonna drop our next
Our next poll
poll
question.
question. So how are you coping with stress at this point? Because I mean, stress can do a number on your health as well, you know? So from your perspective, medical perspective, what can we do to alleviate some of the stress that we're under, pressure that we're
I mean, the common ones that I've been
under?
hearing, which I agree with, because this is such a highly covered disease in the news, I would say unplug from a lot of the noise.
Mm-hmm.
And if you want to get advice that you can trust, just find a few reliable sources. So people are saying check the news twice a day, tops. So maybe you might do a morning and an evening check. I would say the CDC, the Center for Disease Control, and the WHO, the World Health Organization, are two good international sources. And then you have to tap into your own health ministry in your country. And outside of those three, I think that's great.
Mm-hmm.
And if you have a doctor, if you have an issue, you run it by your GP or your doctor. I'm good. For me, that's all I need, because in the group chats and the WhatsApp chats, it's rampant, it's wild.
It's hard to control it.
Out of control. So
yeah.
And then you're getting all these videos about all these different things, and you don't know what to believe.
Janelle says that, I think this is regarding stress, that it's coming at her in waves. I'll be fine, and then boom, it will hit what's happening. That happens to me too, because my regular everyday life is I work from home. So our lifestyle hasn't necessarily changed, but once in a while it will literally hit me that, you know, literally everything has changed.
Do you find though that you have triggers for the wave, or it just, so like when you hear the numbers change, is that what triggers it? You know
Yeah,
what I mean?
I'd wonder what Janelle would say, but I know that she's a nursing student as well, so that could be a big trigger too.
Of course, of course.
But in terms of the responses, we have so there are 3 response areas. There's meh. Hi, Fed.
Well, what a more appropriate time to have a conversation about moms and dads. So Seth is here, guys, and as well.
We have a snack rationing. So ask me what your snack ration is for today. Glad to get creative.
Talk about that too. Yeah.
But the responses were meh, not well, and I'm doing okay. And we got 60% meh and 33% not well. Nobody says that they're doing okay.
Well, 33% is a significant number. I'm not sure what your sample size is, but and may for me is indifferent. It's like I think it depends a lot on your personality type, how you respond. I'm generally relatively calm, but I'm also in a medical profession, which means that I may have more information that helps to keep me calm.
Yeah.
As well as I could probably have information to make me freak out too. But at the same time, I'm not particularly worried. I think that we'll get through it. I think the most difficult part is how long it's going to take, which we don't know.
Yeah.
How it affects the economy, and a lot of people are losing a lot of money because they can't work in the way they used to. And it's going
Yeah.
to be difficult. The hard patch is going to be rough.
Mm-hmm.
But on the other side of the hard patch will be new opportunities, amazing creativity. I'm sure the art and the music that will come out of it will be great.
Mm-hmm.
I'm optimist. I think some people, if they're really thinking about how to pivot and change course, they're going to come up with something brilliant.
Janelle said that she hasn't found a trigger, but it comes every now and again. And
Mm-hmm.
Nadia says she's when she's at home, she's great, but when she goes out, it's another story. That's for me too. Like my anxiety goes through the roof if I have to go on the road.
Yeah, the road is rough. And based on the new mask recommendation, I'm sure maybe the masks might give people more comfort. So maybe you might need to get a fancy mask and you can, and
Dude,
wear it when you're
you,
going
you
out
know I'm psychic, so I actually went and like got masks before all this
before
went
this.
on. Yes,
you,
guys,
you
quickly.
preceded the CDC.
Yeah, like I literally stayed lay waited at a pharmacy for 2 hours on a distributor to reach there once. Can I help you?
And to be honest, Jamaicans are actually not the best at social
Then eat
distancing.
what
So
is
we
in
have
the.
a very poor sense of personal space. So even like I go to tax office yesterday and them have the markers on the ground, and a lady step over the marker and she like right behind me, and I said to myself, woman, you know, see the marker, why not stand up behind it? And she was like close to me, so I said, I just didn't get it. I mean, all these barricades, the tax office is very well set up now to
Yeah.
protect the workers, but yet people are coming close. I'm like, come on.
I mean, I have an issue with the personal bubble thing. I remember once standing in a line and a woman with some, I mean, I got big boobs, but this woman, she was well endowed. And her boobs kept like brushing my back. It was terrible. So I'm actually quite happy with the whole social distancing thing now. You can literally tell people for ease off.
Right, you don't have any random contact, right?
Okay, so
But let's
huh?
okay, let's look for the next question. Let's throw in a few other things. Unplug, find something fun to do on TV. I like TikTok now. It may not be an adult demographic, but do something fun with your kids, with yourself. Find a cool movie to watch. Take a walk if you can. I don't know. There are things to do.
There are things that we can do.
Find a project that you always wanted to do. And
yeah, so people are saying that they wouldn't mind if 6 feet stays like a permanent thing. And yeah, like it's hard not to know what's going on, but you know, it's good that if you can kind of unplug a little bit. Okay, but back to some of my questions here. So in terms of the home, you know, like where do you think is the most vulnerable spots in homes? Like what should we be more mindful of in terms of what surfaces should we be cleaning more? What would be your directive?
Well, here's where I'll start. If no one is moving outside and we feel comfortable that everyone in the space is COVID free, then technically, if no one has the virus, then nobody's spreading the virus. You know what I mean?
Yeah.
So the spread of the virus, again, because of droplet spread and contact, is going to really come down to the traffic in the home space. So, you know, if you still have people who are coming from outside into the house, like you have a day's worker or a gardener, or somebody who is interacting with the outside world who periodically comes inside, then I think maybe you may have to develop some kind of strategy to figure out what areas may be more high risk based on the traffic. Assuming that we're at home and isolating, or I should say social distancing, I would say anything that can move from hand to face. You know what I mean? Because again, that would be the most common way you'll get it: hand to mouth, hand to nose, hand to eyes. So that would mean doorknobs, commonly touched surfaces, kitchen counters, probably bathrooms. Even though bathrooms actually tend to be cleaner than people think, because they're often cleaned.
They're often cleaned.
Yeah,
like I thought about the simple fact
bad.
that when last did we clean the handles in the kitchen, like you know, the cabinet doors, the fridge door handle.
But Anika, we had a power about this too, and it depends on your perspective. I know a lot of the research is showing that the virus can live on certain surfaces for different time frames, and I think that has driven a certain amount of paranoia in terms of people wanting
I'm
to clean.
paranoid.
I know that you lean more to the side that you would want to wash every grocery that comes through.
Oh, yes, I do.
I lean to the other side where if it's going to be cooked and heat is going to destroy it, I'm not worried. But no, you're talking about the packages that the meat comes in, and it can really create a
The
lot of anxiety
lentils.
that I feel some of it is a little bit unnecessary. I don't clean your stuff off, but I don't think you need to be washing off every grocery bag and every single thing that come through the house. I mean, I've seen some of the research, and I think cardboard cartons might not be one of the high risk ones. I don't think it lives very long on a carton. But I don't know if I'm gonna spend too much of my time spraying down a carton.
I mean, the process of bringing groceries into the house right now has gotten insane. But
But I would,
I'm personally erring on the side of caution.
and you know what? I cannot wrong you because this is nowhere, and I think I'll give people some individual leeway because look at the mass situation. Look at how
Yeah.
the mass situation has changed as more information becomes.
Yeah.
So I mean, we were telling the people on the street to them fool because them and wear them masks, but they were probably protecting themselves.
Exactly.
Here we are about to all probably be wearing masks for months.
So I'm also curious in terms of what should a plan be if one of the family members gets ill? Like, do we need to designate an area in our homes for isolation? Do we need to plan ahead? What would be your advice in regards to that?
I think you should plan ahead if you have a family. Thankfully, the kids are out of school right now, so they're kind of, well, driving the parents crazy, but in a way easier to monitor because they're right in front of you. So maybe the parents may actually be the ones that create a greater risk if they're still going to work. Let's define ill. We're talking ill like if they have symptoms that resemble.
Right.
Yeah, you're going to have to treat the person like they're positive. That's really what you're going to have to do. You're going to have to treat them like they're positive. And let's say you as the parent have the cough and the fever. You should probably wear a mask in the house if your child doesn't have it, or if your partner or husband or wife doesn't have it.
Right.
Because you're just trying to protect everybody. Given the nature of the spread, though, it's very possible everybody may get it. But let's just say you won't have it. I would actually self-isolate. I mean, probably if you have a room with a bathroom that you can use, if there's a bathroom that people have to share, then you're going to have to go clean it after. You're going to have to treat it like a sterile space almost.
Right.
And for your, at least your symptoms are gone, but even then, I open up another can of worms. Because people seem to still be able to spread the disease while asymptomatic. And they have seen a few people who are still shedding the virus up to as long as, the longest I think is 37 days.
Wow.
I think that person may have been symptomatic that whole time though. But
that's a term, shedding. When you're shedding the virus, you can still.
I use shedding, and I mean, and shedding technically would mean you're still infectious, and I guess you could probably shed from droplet spread. And there are some studies that show that there might be some fecal-oral spread. So that's really meaning that it probably can come out in the feces. Those studies were kind of patients who were positive. They were swabbing surfaces in the medical room and finding that they were still picking up virus in certain places. Yeah. And this stuff will scare people. So I don't really want to scare people. The ministry, as you heard, they're saying that the people who have 2 negative tests, they have to have 2 negative tests to be discharged. When you get a negative test now, the new protocol is that you will wear a mask for 14 weeks after discharge.
14 weeks.
Days.
Oh, okay.
My apology. Yeah, 14 weeks is long.
Yeah.
But what they are doing is really tapping into the same kind of medicine I'm talking about now, which is you may still be able to spread. And since we're not sure, you're going to wear a mask for 2 weeks after you come out, despite the negative test.
Well, so we touched on the fact that if you're experiencing symptoms, I mean, it's cold season right now, or allergy season. It's allergy season right now. I mean, people can still catch up the common cold. I myself have had a little bit of a cough for a while, no fever, but at one point, I was paranoid and panicking. But I mean, when do we panic? When do we call the doctor when, because we can catch a little bug right now at the same time, you know? So when is a good time?
Well, my first answer to that will be like, you have to really know yourself. So if you're an allergy person, I think you'll have an idea what your allergies feel like, and you may actually know triggers for them. And one thing I will want to say is that allergy symptoms do differ a little bit because you tend to have more sneezing with allergies and stuff
Mm-hmm.
like tearing of your eyes, and you may have a runny nose depending on how your allergies manifest. But those aren't the common symptoms for COVID.
Okay.
And the common symptoms would be fever, cough, and shortness of breath. But there are some others that are high up. Fatigue apparently is like number 4. It's one of them, it's up in the list. And they have some that are less common, but also happen like diarrhea and stomach upset kind of stuff.
Mm-hmm.
It makes diagnosis very tricky. I mean, the only way you can be sure sometimes is if you were to be tested, which is not happening routinely. So there are gray areas. But let's just say allergies, you may have triggers, sneezing, yada yada. COVID,
Mm-hmm.
fever, cough, shortness of breath, fatigue, more likely. And especially if it's unexplained. So if you're somebody who's never had allergies and then you have all of these viral type symptoms that resemble COVID and you've never had them before,
Uh-huh.
that's suspicious. Um, and of course, you call the ministry if you fit into the criteria of coming into contact with somebody who's positive. You had recent travel, especially from one of the hotbeds, which is like everywhere now, but like the UK, USA, those things still apply. And I would say worry if things get into a space that you feel that you cannot control. So shortness of breath is an interesting symptom because most times people don't have it.
Mm-hmm.
And you really normally breathe like about 16 to 20 breaths per minute, you know. So if you were to breathe in and out and look on your watch for a minute, you probably will breathe 16 times in a minute, right?
Mm-hmm.
Let's say you're breathing over like 20, 22, like, you know, you're breathing 40 per minute, which is fast. Or you're just
Right.
really going like a asthmatic would. That's concerning, especially if you
Yeah.
can't lie down flat or you're having some symptoms that making you feel very, very uncomfortable. You'd have to call the ministry immediately because you may need to go to the hospital.
I keep looking at my phone because I'm double checking for questions.
No
Because
problem.
for whatever reason, the poll thing on the right hand side is not showing me. It's like I can't hide it. And I know that there was a comment that came up a while ago. So Amalia says, I'm not so sure in terms of the context, but she says, is that any symptoms or a combination? Example, my household, we, I guess they have a combination of like sinusitis, asthma, coughing, or sneeze. Or should we call the hotline at the first sign of any symptom or a designated combination of symptoms? And I think you might have touched on that a while
You know, I would just to make it clear to her though, designated combination is the answer. So for you, Anika, who had a cough that you may have thought was an allergic cough in the absence of fever,
Mm-hmm.
less likely. Um, what makes the lines blurry though is that if you have people who are asymptomatic, it means that you can run the gamut of no symptoms to the worst of symptoms, which
Right.
this is where knowing yourself would be important. But I would imagine just like you get a flu, you start a fever, you have body ache, then you start cough, and all of them just start happening
Mm-hmm. Mm-hmm.
in a cluster of symptoms, then that would seem more likely
Okay,
than
I
just
got you.
just like one. Yeah.
Okay, so at this point in time, how should parents know interface with their personal or their child's doctor?
And by that question, how you mean? Meaning
Meaning,
should they be
like,
contacting the doctor more regularly than regular visits and routine visits?
well, so the typical thing would be, if your kid comes down with a fever or something, or they fall off of the bed, like what should we do instead of the regular response would probably be to take the child to the doctor. What should be the new response? Because we
Well, the
should be
new
avoiding
response.
doctors, offices, and hospitals, etc.
Well, the logic of avoiding it is really social distancing if you have those symptoms to prevent spread. But it doesn't mean that we don't communicate with our doctors anymore.
Mm-hmm.
It means that you're going to become a telephone consultation. So you really are going to have to call your doctor first. And a lot of the doctors in private settings are either closed, some of them, or fearful. But
Mm-hmm.
for my office, I have a mailing list for my patients, and I've instructed all of them to call before coming,
Mm-hmm.
right? So everybody calls before coming, so I can screen them. I screen them. I literally speak to them and I say, what's going on? What's happening? You're having respiratory symptoms, and then they assure me that they're not having any COVID-related symptoms. And then if they're not, then I let them come. And I see
So
them
the best thing to do would be to call ahead.
all ahead.
Um, hold, yes, set. What?
Because even though this is not for parents, for adults, people still have the run of the mill stuff, like people still have urinary tract infections and yeast
Said, I don't want
infections
to hear
and
about a robot right now. I'm doing
all
something.
sorts of things that they still need to be treated urgently, you know?
Yeah, so Janelle had said like girls are due for yearly checkups and she's pushed it off.
Right. So if
Yeah.
it's not something that is pressing, I
Mm-hmm.
would say we can wait it out. I mean, I think vaccines are important, and even vaccines are not always pressing. 'Cause even if a child is not well, a doctor will hold a vaccine, you know?
Yeah.
We just want to ensure they get it. And hopefully we're looking at a few months of waiting, which I think
Mm-hmm.
won't do a child any harm if they miss a vaccine.
Okay, so you brought up vaccines.
Mhm.
So we're just gonna go into it. Vaccines are always a ticklish topic. There are certain conversations that I try not to have with people. That's usually about religion, politics,
And
and
vaccine.
vaccinations because people be crazy. So let's gently just talk about a vaccine and the possibility of a vaccine for COVID-19
Well,
or
I
for the
can't.
coronavirus. Yeah.
Right, exactly. I can't speak to a timeline on it, 'cause like everything with Corona, is under development. But a secondary part to the flattening of the curve is that you're hoping to social distance until a vaccine is developed. You'll hear people saying that. Because the hope will be that, well, for the people who didn't get it, you can potentially vaccinate them and it will
Mm-hmm.
give them protection. And for people who don't understand the principle of a vaccine, they come in different forms actually, but the aim is really to give you a very weakened dose of the virus, but it could be live attenuated, which is the real virus but weaker.
Mm-hmm.
Sometimes it's dead. So they come in different forms, and the aim is to develop antibodies. And antibodies are those good things in your body that protect you from disease if you ever run
Mm-hmm.
up into it again.
Because like
So
the polio vaccine is live.
now you see, you're taking me back to the early days, but we're gonna double check. We won't tell anybody any foolishness.
Because I remember coming across something when Seth was a baby that during like the polio vaccination or if you get in a booster, well not for booster, but make sure that you have had your boosters, etc. because it's live vaccine and yeah, getting all
Yeah, no,
technical.
no, you're right. Some of them are what we call live or live attenuated.
Mm-hmm.
Um, and if for polio, they have IPV, which is the inactivated polio vaccine. But this is actually, I'm glad you brought it there, because that's exactly what people worry about though. They're like, when they hear the word live, they're like, oh, so it's the same thing like the real disease, and that means that's not good.
Mm-hmm.
But I mean, in order for the body to respond, sometimes live attenuated is not a bad way to go. Just that sometimes, like when you take your kids for vaccinations, they tell you your child might develop a fever. And that's because you do get a response sometimes, though
Right.
mild, though mild, but it's not anything compared to going through the actual disease process most times.
Got you.
So vaccination has been great at protecting us over the years. You don't see stuff like measles and mumps and rubella anymore. And all Jamaicans get MMR, and I
Mm-hmm.
wanna get the one where we get at birth.
Tdap is Tdap.
Not that
T
I
T
just
T.
blanked on it, but where everybody has the nice scar. that you-
Mm-hmm.
So we don't get
Diphtheria,
look at me
something
blanking.
else.
And I know this so well. This is my life. No, it's a disease of the cough, tuberculosis.
Tuberculosis.
That's the disease, and that's what this one is for.
So there are a couple. Okay, so there are a couple more questions. I'm gonna come to the questions in the comments.
Oh, the BCG vaccine, though. I couldn't let it go. BCG vaccine to prevent.
BCG. I knew it was. Hear me about TCP. What is TCP?
There's a Tdap. There's a Tdap too. No, you're right.
Tdap. Oh, okay. Okay, good. All right, fine. All right. So in terms of, this is a really important question. So how can we monitor symptoms for nonverbal children or infants? I mean, obviously from like a fever, it's different, but a baby may not necessarily be able to say that their throat is sore.
Well, here's the deal with very young babies, and we're talking babies under 1. I think especially under 6 months, when they're very, very young, like neonates, sometimes they don't even mount fevers. But from you have a neonate with a fever, you're going to your doctor or the hospital. Because, they may have something like a urinary tract infection or meningitis or something that needs to be investigated. And of course, they can't speak. So you're forced to check that out. And neonates have weaker immune systems too. So they are an important category. Coming up in age, I think you need to just treat everything similarly with kids and fever. Kids are a tricky space, again, because they cannot articulate. What I would say for the younger kids who are like in that 2, 3, 4 ballpark, if this looks like a typical viral illness that as a parent, you would be comfortable watching at home, coronavirus, COVID-19 wouldn't be any different, right? You would watch this child. I normally use a 3-day rule. If the child has a high fever for longer than 3 days, check it out. Most times I don't think you need to rush to the hospital. But again, really what COVID-19 is doing to us is really forcing us to self-regulate and use our judgment, which is hard for our culture that likes to run to the doctor. So the world is being forced to kind of be the doctors in your own home.
Yeah.
And it is scary for a lot of parents because they want to just run in for the first fever. But no, you see a fever, give some Panadol, watch the child. Fever goes down, child is playing again and eating. Okay, don't look too bad. Day 2, fever come up again, give some Panadol, give it around the clock. Oh, when the fever is gone, child is happy, fine. 3 days, good. Fever might disappear, child is good. Great, we never had to go to the doctor. Day 4 come, fever is still raging, child not eating. This is a little weird. You know what I mean?
At that point, call a doctor.
Absolutely. And then at that point also, things take a while to develop. So usually by day 4, on day 1, when you get a high fever, sometimes you're looking at air, the air is not red. Day 4, you have a high fever still, and you look in the air is red. So it takes a little while sometimes for the signs to manifest, is what I'm saying. So sometimes waiting a little isn't bad, but then there are times when you can't wait. Child have an asthma attack and wheezing, you go to the hospital. So it's a big judgment call, and you just have to be assertive and alert and monitor and know your child and watch them carefully.
So just a couple of last final questions from me, and then just going to go into the comments quickly, because we're at the 46-minute mark. But I would like to know, in terms of your recommendations for building immunity at home at this point in time, like how can we boost our immune system? What would you recommend?
So Anika, it's a tricky space for me, and I get this question in all of my COVID-19 chats. I am old school in that I believe that a balanced diet is adequate to provide you with the micronutrients that your body requires. I think people view vitamins and immunity as something that you have great control over. I don't think we have as much control over it as we think. But I do think there are categories of people who benefit from vitamins and multivitamins, and they would fall into the immunocompromised, like someone with HIV or with a weakened immune system. Children sometimes, because they can have poor diets.
Right.
Children can be very picky, so they're not getting and elderly. In those special cases, I think fine, provide a vitamin supplement. outside of that, most adults, most healthy adults, get some rest, drink enough water, exercise, have some fruits and vegetables.
And
And
get
if
some
you
sunlight.
get some sunlight for some vitamin D, and if you do choose to take a supplement, it won't hurt. It really doesn't hurt. It will
I had
just,
to remind myself the other day to go outside, like just to go sit in the sun.
but yeah, I'm not the guy to give you too much comments on home remedies and that stuff. I mean, there's some people who really specialize in that side of it.
Yeah.
I can't say that's my thing, and I don't do it either. So I subscribe to my own advice. I just eat regular. I exercise.
So here we have a couple of questions. So what medical supplies do you recommend we stock up on in the event that we do get it and have it in a mild form?
All right, so anything that you would get for a flu would be the same thing that you'd get for this. Because the symptoms are going to be along the lines of fever, cough, you may get some diarrhea, stomach upset. So have all of your over-the-counter stuff, like your Panadol for fever, have a cough syrup on hand, a Histal, a Histotussin, one of those things. Given the mask situation, it would be great to see if you could acquire some masks for the family. You never know, might be cool to have, if everybody could have like a little mask, if it's not small kids. And rehydration salts. We don't normally treat diarrhea with antibiotics. So if you can get some Pedialyte is good. Adults can drink Pedialyte too.
Yeah.
Even if it's not Pedialyte, you can drink
Gatorade.
it. Gatorade may help, but sometimes the sugar in Gatorade can be a bit shitty. So, and then you can buy the packets in the pharmacy, the real cheap ones, oral rehydration salts. You mix them out in a gallon of water, keep it in the fridge. You're supposed to consume it within a 24-hour period, and you normally give some after every loose stool. So those are the kind of things I would say: fever medication, cough and cold medication,
A
mask, rehydration salt, and then otherwise just ensure you have spaces that people can properly self-quarantine or isolate if they do need to isolate, and you need to keep them in a corner of the house.
I have another question here. As adults who would have been vaccinated, which should, so this is not necessarily related to what we're talking to COVID, but which booster should we get now, if any?
All right. You don't need to get any boosters specifically right now. And the reason I'm saying this is because there isn't any cross protection from the previous stuff you got as a child to what you have now. And like, for instance, the flu vaccine, which is influenza vaccine, influenza is a different organism from coronavirus, which is why they have to develop a vaccine for coronavirus. But they do behave similarly in that they're contagious and they cause similar kind of viral symptoms. What I'm thinking might happen is that this coronavirus, if it's like the flu, if it behaves like the flu, then you'll have seasonal strains, right? You may have more coronaviruses that come up, but hopefully they won't be as severe as this one because we would have been exposed to this and gotten used to it. Because we get flu every year, multiple times for the year you get a flu, sometimes. So the hope, so no, you don't necessarily need any specific boosters. I would say the only people who maybe could get vaccines are the elderly, and that would be pneumovax, and the flu vaccine might be good for people over a certain age, like 70s, up in that ballpark, can benefit from having it, not from COVID, but just having it in general.
Just having,
protection.
Okay, are there any other questions? You can just let us know in the comments quickly. But yeah, but thank you so much, Mario. I really appreciate it.
Thank
you need to tell people where they can find you. I know that you're on MD Link as well. Yeah,
I'm now on MD Link, but where I want to direct you to my website, which is drmarioguthrie.com, and it's DrMarioGuthrie.com.
I'll put it in the comments.
Yeah, man. So that would be the easiest way to find me medically. I'm also on Instagram as @DrMarioGuthrie, spelled the same way. And yeah, the videos, again, youtube.com/Mario Guthrie. You'll see some medical videos. And those are all the medical stuff. That's all I'm promoting on this site tonight.
But yeah, the videos are really good, guys. So you can check out the Dr. Mario Guthrie's YouTube channel. And these videos will, of course, be available on Facebook, but I'm also putting them on the new Island Mom YouTube channel. It's only
That would
taken
be
like
this
6
Zoom
years.
video, right?
But apart from that, I do want to just highlight that we have 2 more scheduled lives next week. We have Trishan Houghton, who will be doing a deep relaxation practice. We all need to kind of unwind at this point in time, and she's going to get us into a nice meditative space. And she'll be available for question and answer as well. And we also have a great live session with Lorianne Ainsworth, who's the CEO for Branson Center. She'll be also coming on live to answer questions, and her topic is thriving through life and business, because we have a lot of moms who are either running a side hustle or have a business and they're struggling at this point in time. So we have, and of course, Island Mom After Dark will continue. I'm gonna be consistent, y'all. but but for now, I don't see any more questions popping up in the comments. So for now, thank you so much, Mario.
You're welcome.
And I will include your tags and so forth in the comments.
Yeah, man.
But thank you again.
Yeah, man, you're welcome, guys. And take care, stay safe, don't worry too much, and still enjoy life while all of this is going on.
All right, thank you, guys. Thank you for joining us, and look out for our next Island Mom After Dark. Okay, so we are off of live.
But we're still recording. All right, that's okay.
But we're still recording.
That's all right.
Wow. Thank you so much, Mario.
You're welcome. You're welcome. It's intense, all this online work. But no, it was cool. It was cool. I mean, as long as we're helping people, that's great.
Yeah, definitely. I'm going to be doing some separate lives from the Business Chic CEO side. But for me, this was more urgent. The mom
right.
needed.
Those are going to be IG lives, right?
Yes. I'll be doing IG live, but also more than likely have a kind of webinar set up in Zoom separately. So I'll have the workspace in Zoom and then IG live.
All at the same time?
Yeah.
Interesting.
Thank you, dude.
Everyone got change my shirt. Good angle.
The next appointment.
All right, later.
All right, later.